You know, we've all heard this statistic. Heart disease is the #1 killer in the United States. But what if I told you that's not the whole story? What if the vast majority of it is preventable? This isn't a battle we're destined to lose. The reality of this crisis is, well, it's staggering. But the solution? It's much, much closer than you think. 34. Every 34 seconds, someone in the United States dies from cardiovascular disease. Just let that sink in. Every 34 seconds. That means by the time we finish this conversation, hundreds of families will be changed forever by a loss that most likely didn't have to happen.
And that's the real cost, isn't it? It's not just a number. It's the father who won't be there to see his daughter graduate. It's the mother who misses out on years with her family. This is a crisis of empty chairs at the dinner table, measured in precious moments that are just gone.
So to really understand the solution, we first have to wrap our heads around the sheer scale of this 34-second crisis and who it's hitting the hardest.
Okay, check this out. Cardiovascular disease is responsible for 1 out of every 5 deaths in the U.S. To put that into perspective, it kills more people than all forms of cancer combined. I mean, think about that. This makes it, without a doubt, our country's most urgent health imperative.
And buried inside this crisis is a hidden epidemic, the women's health gap. Heart disease is the #1 killer of women, full stop. Yet our system is consistently failing them. Women are more likely to die from a heart attack, and the disparities for Black women are just staggering. But here's the part that's truly unbelievable. Fewer than half of all cardiologists feel they're even properly prepared to assess heart disease risk in their female patients. It's a profound systemic failure. And this, right here, is the most important part of the entire story. Because despite this overwhelming problem, most of these deaths don't have to happen. There is a massive, gaping hole between what we know works and what we're actually doing.
This is one of the most glaring failures of our system. After someone has a life-threatening heart event, something that lands them in the hospital, nearly 80% of them don't get a basic, absolutely essential follow-up check of their LDL, their bad cholesterol. This is just a massive missed opportunity to stop the next and possibly fatal event from happening.
And this brings us to the central tragedy and also the central hope of this whole thing. This isn't inevitable. First heart attacks, second heart attacks, they are almost always preventable. We have the knowledge, we have the tools. The problem isn't the science, it's the system. Let's just look at the difference a truly dedicated, proactive system makes. On the left, that's the status quo. Barely 1 in 5 patients gets their cholesterol checked, and an incredible 68% are right back in the hospital within 6 months. But look at the right. In a dedicated prevention center, 90% get checked, and almost all of them, 95%, hit their life-saving cholesterol goals. The data couldn't be clearer. A focused prevention-first model just works. And you know, this isn't some theoretical model cooked up in a lab. This success is being driven by the vision of a real pioneer who is out there proving what's possible. It's really the story of one doctor's mission. For years, Dr. Nathaniel Lebowitz has been the powerhouse behind this prevention-first approach. He's a nationally recognized leader who has proven, against the odds, that a different outcome is possible. He's built the blueprint for a new standard of care, often, and this is the key, single-handedly. But here's the thing. This one-man mission is completely unsustainable. For his thousands of patients, Dr. Lebowitz has to be all of these things at once. The top lipid expert, the dietitian, the educator, the researcher, the social worker, the care coordinator. It's an amazing testament to his dedication, but it's just not a scalable solution for a crisis of this size. And here is the direct, heartbreaking result of that overwhelming demand. New patients, people who are at high risk of a life-threatening event right now, have to wait more than 7 months just to get in the door. For someone in their position, a 7-month wait can literally be the difference between life and death. The solution then becomes crystal clear. We have to scale Dr. Leibowitz's proven model. We have to build the infrastructure to support this incredible, life-saving work and create a new, accessible standard of care for everyone. The answer is to build the Lipid and Cardiovascular Disease Prevention Center of Excellence. This will be the first program of its kind, designed from the ground up to catch risk early, use the most advanced diagnostics, and give every single patient the kind of wraparound support they need to not just survive, but to thrive.
And look, this isn't just an idea on paper. It's an expansion of a program that's already working. It's called the Get to Goal program. A high-risk patient is identified the moment they're admitted. Before they even leave the hospital, they get life-saving medication and education for them and their family. The center's team handles all the insurance red tape and tracks their progress. And the results? We're betting readmission rates will absolutely plummet. This is the kind of innovative care the center will provide, but on a massive scale. So, this brings us to the final, and honestly, the most crucial part of the story. We have the proof, we have the leadership, we have the plan. Now we have this incredible opportunity to make it all a reality, to save lives right here in our region and create a model for the entire nation to follow. The simple truth is, a transformation this big requires visionary partners. To build the facilities, to hire the team of specialists, and to expand access to thousands of patients who are waiting right now, this center will only be possible with transformational philanthropic investment. And the return on that investment? Well, it's measured in lives. Support for this center directly translates into fewer preventable deaths. It means transforming the health of an entire region. It means giving people access to the best care available, training the next generation of doctors in this new model, and ultimately creating a blueprint for prevention that can be copied all across the country. This is a true legacy investment. So I'll leave you with this question. We know heart disease is a crisis. We know it's solvable. We have the leadership and we have the plan. So what if, together, we could stop accepting this tragedy as just the way things are? What if we finally made prevention the new standard of care?